issue. Hello, medical students and international medical graduates. This is Hussain Abbas. Welcome to the channel MedDex with Hussain Abbas. So far, we have discussed about the research work and we have uploaded the video to how to initiate the research work. Okay, and we have so far discussed what not to do in the research, what not to initiate before starting the research. Okay. So today the topic is about the Journals Club. What is Journals Club? The question is that the Journals Club basically, if we talk about earlier in 1875, so Sir Williams in 1875 started the Journals Club. It is basically the room in which there are 20 to 25 doctors, medical students, residents, fellows, where a research paper, a published research paper, has been discussed under the committee, under the scientific committee, and different aspects of the research has been discussed in there. So in the journals club, you are just, or if you there are two possibilities. Yes, one you have to present, and the other you have to listen. So when you have to present, like create a scenario, or just like I have written down something like. Your seniors handed over your research paper at that time, and now they WhatsApp you a message of a research paper that like Hussein, you have to present the research in the coming Friday, in the coming morning, and you have to present the research in the journals club meeting. So what you have to do? So don't panic. Okay, so basically I have give you the intro, I have give you the so far background about the journals club. Journals club is basically the meeting where the doctors discuss a research paper of the latest intervention or latest outcome, or there is an outbreak of disease, or there is any pandemic, or anything, a new medicine, a new immunotherapy which has been introduced in the literature. So that has been discussed for the sake of medicine, for the sake of patients ethics, for the sake of to grow simply the literature. Okay, my might be my voice is not clear, or I think I'm not as much audible in sense of what you are saying in your mind. So please give me the some time and I will cope up with it. Okay, so come to the point. Journals club. So I've written something points in my laptop, and like to share with you. Okay, so journals club basically, I have said that educational meeting that was introduced by Sir Williams, and in the journals club we have to learn something which we cannot learn, or which we cannot learn beyond our clinical practice. Okay, so before you open the paper, you have five things to check about the paper. Number one, the paper is format index or not, or if so. Basically, you have to open the paper and you have to check the five things. Number one, the journal where the paper have been published, is that PubMed index or not? It matters most. The authors and institution where the research has been done, from which institution has given the approval, and who are the authors. Authors section is might be unknown for you, but just for the sake of authenticity of the paper, authors have been charity sometimes. The date is very important. Like if the study has been done, or the results are concluded in like 2010, 2009, or in early 2000, that's our abandoned in this era, this time. Okay, so date is very important. The study tab means, is that it studies RCT, is that it studies meta-analysis, is that it studies cross-section, and based on what you have to present, you have to choose the study tab. Okay, side you or your senior says you that like you have to work on, or you have to initiate a clinical trial. So you might be looking for the randomized control trials, RCTs, not looking for the cross-sectional or case reports. Okay, so that is the point. So after analyzing all these five checklists, then you have to go for the research work. Then you have to go for the paper. Now, I am assu- I am assuming that you have selected your paper, you have quickly checked the paper. Now, what to do? So you have to create a PowerPoint presentation simply, where you have to make the slides, And after making the slide, you don't just go through or you don't just read the slide, you have to dissect the information. So what I am saying, you have to just tell about the where the study has been conducted. Okay, that you can tell about author and hypothesis. What is the hypothesis of the study? What is the purpose to run this study? Then you have the selective results. Now this is very important thing, that you have not written all of the points, all of the tables, charts in the result section. You have to just select one to do, and you can describe them easily. Okay, so there are on the screen, you can see that there are the so on the screen you can see that there are the result section in which the work has been done, and you can explain them in the meeting. Okay, then the last point is about the critical discussion. So critical discussion is that what you have learned from the paper, what you have already read the discussion portion of the paper, you have to elaborate them in the meeting. Okay, so point number one. So point number one, you have to ready about the questions which cannot be answered by you. So don't be ashamed. These questions are naturally, take them naturally and say no if you don't know the answer. But go and pass. Second thing, which is important, you have to highlight the limitations of the study, where the study is limiting, what is the next goal, what would be the next perspective of this study. So that is very important. A good study always concluded their research with the limitations of the study. So, after all of this and viewing the study, now I have selected some studies in the upcoming videos where we can learn how to first of all read the paper. This is very important. Before you are presenting in the journals club, before you are presenting in any, first of all you know how to read the paper actually. So there is a couple of videos in I will upload it as fast as I can, and the work is doing on the videos where I would tell you that how to read a research paper of different study designs. Okay, thank you.